I have been a nurse for over 30 years, and I was extremely lucky and blessed to end up in oncology straight out of school. So it is definitely a passion of mine. In addition, I was, after working in the hospital, when I started in the outpatient world, I ended up in a practice that supported integrative oncology. So that's where I began to be introduced to the ideas that there's far more to caring for people than just giving drugs. So I started out by getting interested in energy therapies, in particular healing touch. And healing touch is great for nurses because it's a nursing-based practice with a set curriculum for all people who take it. And it comes with CEUs. So nurses always love to get those CEUs. I have also gotten a certification in clinical aromatherapy through the Buckle program. That was a year-long process that involved modules and practicals and an examination. But aromatherapy is a wonderful practice that can be used for most people. And inhalation in particular of essential oils can be so therapeutic on both mental, psychological, and physical levels. I did a certificate program as a holistic health instructor. So that just kind of helped me to be able to work with people and create curriculum and materials if I ever wanted to present different things. And I kind of rounded this all off with dabbling a little bit in acupressure, which is using directed touch on specific points for symptom relief, and ended up getting certified by the American Holistic Nurses Association to support my practice. And I started mostly with underlying educational thing for the staff. So I have run monthly staff in services on a variety of different things. And I'm always interested in pulling in the people you know who know things that you don't. So these monthly in services can be based on anything from, say, the microbiome and nutrition, to me talking about healing touch, to acupressure, just so everybody, music therapy, just so everybody learns that there's something new out there, and no one thing always works for everybody.
And as you teach the nurses and probably other staff about integrative oncology, what then does become the role of the staff nurses once they have this awareness about integrative oncology and complementary therapies and lifestyle practices?
Well, I think that's the big thing, is that when you first start to learn these things, you start with your own development, or you start with your own inner self. And a lot of times, breathing is one of the main things that I educate people on, because diaphragmatic breathing, regular breathing, and meditation is something that we all can practice. It's free, and we can use it whenever we want to. So the first thing is, people always start working on themselves. And then once they start working on themselves, then it is so easy to start to extend it to the people who are around you, whether it be family, friends, or your patients. So I also offer aromatherapy to staff just for relaxation purposes. So everyone on the staff knows that aromatherapy is available at all times for anyone who needs it. So it's kind of like a referral to me. Hey, Laura, someone needs this, or they're starting treatment, they want the aromatherapy kit. So I think that's the thing, is that if anyone hears that people are interested in something integrative or holistic, they come to me and see where we can go from there. And absolutely, there are definitely acupressure points that are very, very easy to be done by a person or their family. So yes, we could definitely pull that in as well. As I'm a staff nurse, my first priority also, has to be clinical, but I certainly try to make the time and fit in. I love, and energy work actually can be involved in everything that you do. It doesn't necessarily have to be separate, but whenever people need something or it's appropriate, I try to make the space for that to happen. I found early on that I always felt that there was more to caring for someone than just traditional care. I always felt that internally.
Mm-hmm.
And I found that when you are open to things, those, the changes that you need show up when you need them.